Well, good morning. My name is Jeff Spraggins, and I'm a patient of Dr. Nassery here in Miami Beach, Florida. And I have like this opportunity to tell you what a good experience I've had thus far working on a problem I didn't know I had originally, and that's called TMJ. For many years, I was always told I had a very stiff neck. Every time I got a massage, the masseuse would say, "My gosh, you have a terrible stiff neck. You need to reduce the stress in your life." I almost stopped getting massages because I was tired of being lectured to about how stiff I was and how stiff my neck was. I did know, though, that it was hard to back up my car. I had a hard time tilting my head back. But I didn't have much pain, but I just knew I did not have a very movable neck. But late in 2013, I developed a loss of hearing in my left ear. And with the loss of hearing came a roaring sound, like if one puts your ear to a seashell. So I went to my ear doctor and said, "I think I've got too much wax in my ear," which has happened in the past, even though I'd been there 4 months before and had it cleaned out. So I was a little concerned why it came back so fast. And they looked at me and said, "Well, good news, you don't have any earwax." And I thought to myself, I don't think that's good news, because I thought that was my problem. And so we did a hearing test, and they came back and said, "Well, you need a hearing aid." And they sold me a very expensive hearing aid, but it had a 30-day return on it. So I thought, well, I'll try it. But I still said, I still don't think it really is a hearing aid issue. And they said, "Well, we think it is, but he did say you might consider TMJ." And I had never hardly heard that before. And the doctor actually handed me a little printed sheet about TMJ, of which I ignored. And for the next 30 days, tried the hearing aid. It was not helping at all with this problem. So I went to another ear, nose, and throat doctor in Miami, where I live in the winter, and I was told, they checked my hearing, and they said, "Well, it's the same as it was 3 years ago. It hasn't gone down, and you really don't need a hearing aid." So I returned the hearing aid, but I was still left with this left ear. And I said, "Well, do you think there could be a tumor in there that's maybe impinging on my eustachian tube or something?" Well, they did a endoscope. They looked and looked, and they said, "No, everything's fine." I said, "Well, it isn't. I'm not hearing very well." And they didn't really weren't very sympathetic to that issue. And I came back 2 more times to the doctor, to the ENT doctor, and got the same result. "We can't find anything wrong with you. Basically, don't worry about it." So I was beginning to think, well, maybe this is the rest of my life I'm not going to be able to hear well. About the same time, I was getting my teeth cleaned, regular teeth cleaning at Dr. Nassery's office. And the dental hygienist, Donna, was about halfway through. And at the end, she said, "Have you ever thought you might have a TMJ issue?" And I don't know why she said that, but she said it, and I did think back to what that earlier ENT doctor had said. But Donna then got out a list of questions, and we went through them together, and I actually scored pretty high on a positive about the symptoms for TMJ. But Donna suggested that I talk to Dr. Nassery for a couple reasons. One, she said he was very knowledgeable about TMJ, and that he himself had TMJ. So I met with Dr. Nassery, and he examined me without me really telling him much about me, and he almost, after the exam, said, "Well, I think you're probably having trouble on your left side and things." And so I was pretty impressed that he was able to, by an examination. We then took some films. Dr. Nassery's got some sophisticated equipment. And it became clear, he pointed out, that my second vertebrae was tilted and turned. And we went through why, and it was basically because my teeth were not hitting, and my jaw had to accommodate that by pushing itself forward and to make a full contact. And years of doing that had made my muscles in my that operate your bottom jaw, and they're apparently quite strong and quite complicated and sophisticated the way they work, that they were constant in a state of tension, and that tension had really clamped down on my eustachian tube, or that part of that causes the hearing loss. After I had the first treatments, which were really determining how bad my bite was, we did some relaxing of my jaw, both with the physical therapist, but also with some electric stimulation, which I'm familiar with other parts of my body when I had bad knees and shoulders and things. But Dr. Nassery used this to relax the muscles so that he could get a true closure of my jaw to see really where it should be at, and it was way off. So we started a process of starting to align the jaw, and Dr. Nassery explained to me this was going to be a long process because we really had to rebuild my teeth that had been pushed in the wrong direction, and in effect chasing a good bite. My teeth had moved. What I was so impressed with, though, fairly early on, after I had gotten relief, and I think I talked about that earlier, I said to Dr. Nassery, I said, you know, now that I've really got some relief and that my bite is you've got it where you want it on a temporary basis, we still have to do a lot of teeth restoration to keep it there permanently. But I'm doing exercises, and you've put in some orthotics that are keeping my bite close to where we want to get it. And I'm feeling a lot better. I can turn my head, I can back up my car, I don't have any ringing in my ears, and my hearing has returned. And I'm feeling, you know, much better. But if we go back to that first x-ray you took, where you showed my one vertebrae tilted and turned back because of all that strain on my muscles, will that actually show an improvement? And the reason I asked that question was because I've had lots of backaches over my life. I've had knee problems, shoulder problems from playing lots of tennis and being very active. And the orthopedic doctors have always said, well, we won't really be able to show you anything change in the x-rays. It's going to be up to you to tell us if your pain has gone away. We really, the herniated discs in your back really won't look any better, even though you're feeling better. So I thought, you know, I'm probably going to hear the same story here, that vertebrae hasn't changed. But Dr. Nassery said, sure, right away, let's take another picture of it. And sure enough, the vertebrae that had been twisted and tilted was back in a perfect alignment. And you know, I knew I was better, I knew I felt better, but to actually put the x-rays side by side and see that my vertebrae had gone back to the position it should be in was extremely gratifying to me. And it kind of exemplifies what I have had all along with Dr. Nassery and his professional staff, and that's lots of feedback, lots of information, lots of education. You know, one thing I'll say is when I really fully understood what had happened to me and how it had happened and where I was at and what it was going to take to move it back to a good bite and to really have a permanent solution to this issue. The fact that all of my teeth were going to have to be adjusted and in effect a restoration. When that sunk into me, I almost thought, oh, wait a minute, I don't know if this is really going to be worth it or not. I had really felt that I wasn't going to have any dentistry the rest of my life. You know, I'm 73 years old, and my teeth have been always in good shape. Not a whole lot of cavities over the years. But But I just went through the pros and cons, and the pros and cons were obviously, getting a permanent solution to some serious problems: hearing, sleep apnea, stiff neck, and continued degeneration of my joints that operate my lower jaw. I was concerned, and the research that I had done independently showed that I would get worse. I wasn't going to stay the same, and I really had to do something, and that I should do something. Dr. Nassery was able to show me what we were going to do, how we were going to do it, and I'll go back to the thing that when he put those two X-rays together, when I saw that just what we had done thus far had brought my vertebrae back into a correct alignment, I just felt that I had a good partner here in making this work. When we got into the restoration, I was amazed on how, even though it was a number of hours that I was here, that in 3/4 of a day, we really replaced all the teeth, not replaced, but recapped all the teeth in my upper mouth. And I don't want to say the wrong number, but I think it was 18 or 15. I forget how many teeth we have altogether. But we did it all at one time. And Dr. Nassery has tremendous stamina, and everybody in the office assisting him made me very comfortable, and the initial reluctance and fear I had of actually getting that much dental work done really dissipated, and I'm looking forward to my bottom half getting done now, and the process has been painless, and it's been well. I have to say Dr. Nassery is the best dentist I've ever been to, and the way he's been able to, everything he's done in my mouth has been very comfortable, and I just have a feeling that there's lots of expertise that he has, and he's an extremely professional and extremely high qualified dentist. Part of this, what's helped this has been Dr. Nassery's whole approach to patients and to me. One, he's a very intelligent guy, and who's been able to explain this, and who I have very great confidence in that he is up to date and knows exactly the best treatment. He's a very kind guy. He takes his time. He's very meticulous and very caring. And I always feel like that I'm being very well cared for.